Well, the state right now is in a level 1 emergency. That means that the governor has declared COVID-19 the top priority, and it brings with it more resources to fight it.
We want you to stay safe, stay home.
The governor moved Utah to its highest level of emergency in response to the COVID-19 pandemic. Utah barely got out of another level 1. It was used in the 5.7 earthquake that hit the Wasatch Front.
Level 1 means that we now have the ability to draw upon state resources, but as well as federal resources going forward. In fact, later today, we will be declaring, or at least putting forward the state's major disaster declaration to the President of the United States.
The state will put more into the effort to stop the spread of novel coronavirus.
We want to have increased testing and tracing, tracking. We will find and we will deploy PPEs, personal protective equipment, which we have in short supply around the country. But we're going to find and deploy PPEs as we need them. And we're going to plan for any kind of increasing hospital activity level.
The governor says the next 2 weeks will be critical to avoid a spike in cases that overwhelms Utah's healthcare system. He's urged people to stay at home to stop the spread. Right now, every single region of the state has a positive case. The state epidemiologist says there's signs that staying home and social distancing is working.
We just need to continue those efforts moving forward to continue to see the decrease in the rate of cases.
More counties are issuing stay-at-home orders. So far, Summit, Salt Lake, Wasatch, and Tooele counties are requiring people to only go out for necessary travel. But the governor hasn't made it statewide. The Utah Department of Health says it advised him on it.
We do recognize the variety of situations going on across our state, from urban districts to the more rural districts in terms of density of people and cases. And so I think that's why the governor has left it up to the local jurisdictions to determine what's best for them.
Now, there are some new changes at Utah's Department of Health. Dr. Joseph Miner, who is the head of the agency, isn't in the best of health and is considered vulnerable to COVID-19. So he is stepping aside from the day-to-day activities and operations of the agency at this critical time. Governor Gary Herbert has now chosen retired Utah National Guard General Jefferson Burton to replace him. Live on the Hill, Ben Winslow, Fox 13 News, Utah.